Hi, I'm Dr. Michele Ross, neuroscientist and founder of Impact Network. Cannabis is a plant made for women. Is it any coincidence that the female plant is the one that makes cannabinoid-rich trichomes? I'm going to tell you some of the ways that marijuana can help women's health. Number one, your reproductive organs, including your uterus and ovaries, contain both types of cannabinoid receptors, CB1 and CB2. These are the receptors that respond to the cannabinoids found in marijuana or your body's natural endocannabinoids, such as anandamide, which is known as the bliss molecule. Number two, your uterus has the highest levels of anandamide in your whole body. During certain times in your menstrual cycle, like ovulation, your uterus has 100 times more anandamide than your brain does. No wonder why you're feeling your best then. Number three, estrogen is tightly linked to anandamide. When our levels are low, anandamide is also low. When anandamide levels drop, we might feel moody, irritable, crave those fatty foods, hello chocolate, right? Or feel in pain or crampy. Sound familiar? That's PMS. In fact, 3.5% of patients in Hello MD's 2016 survey of cannabis users use cannabis to treat symptoms of PMS. So it's getting more popular, but definitely more women need to find out about cannabis for PMS. Number four, 84% of women have painful periods. Shh, don't tell anyone. Something we don't talk about, but we're all definitely popping Tylenol or Midol and praying that it'll get us out of pain. Others of us are really disabled by this pain, and we have to call in sick from work or take opiate painkillers, whatever gets us to the next day and praying that's over, right? What if smoking a joint could help? Well, it actually does provide instantaneous relief. So does rubbing a cannabis-infused topical lotion on your pelvis. It's a great option if you get drug tested at work because the cannabis is not going to go into your bloodstream and you won't have a positive test for THC. You can definitely do both consuming cannabis via smoking it, eating it, and the lotions. Whatever way you need to use cannabis to help with painful periods, that's okay. Number five, chronic pelvic pain. That's even a bigger secret. Chronic pelvic pain lasts 6 months and impacts 25% of women. That's a lot of us. 1 in 10 women also suffer from endometriosis, and that's a condition that's poorly treated by regular surgeries, hormone shots, hysterectomies. Women are really suffering, and they have no good treatments, no permanent cure for this. Basically just putting Band-Aids on a bullet hole. So can cannabis help? Yes, but you're going to have to do more than just smoke it for lasting relief. Try eating a 1-to-1 or a 2-to-1 CBD to THC ratio, tincture, candy product, edible, etc. For prevention of pain and actual treatment of your symptoms, try a vaginal suppository with THC and CBD in it, like for your relief. Number six, menopause. It's that thing that young women never want to think that they're going to reach, but it's something that 50% of all humans on Earth are going to go through. Hot flashes, night sweats, moodiness. It's not something anyone looks forward to, but the current treatments on the market are just not cutting it. These include hormone replacement therapy, or HRT, has a list of harmful side effects like increased risk of stroke or breast cancer. Cannabis can actually relieve many of these symptoms of menopause without these scary side effects. So tell your mom, tell your sister, tell anyone with a vagina. Want to learn more? I currently teach modulating women's health with an HM plant and treating the spectrum of mood disorders, depression, anxiety, and PTSD for the Holistic Cannabis Academy, which provides certification as a holistic cannabis counselor for healthcare practitioners, bud tenders, caregivers, and patient experts. Thank you.